So we are going live in like 5 minutes, I guess. And
Yeah.
मैं link share कर देता हूँ जब तक. And I think we are already live.
Yeah, it says so, yeah.
Just a second. So we are going live in like 5 minutes, I guess. And see, share कर देता हूँ जब तक. वो उसमें double voice आ रहा है.
Yeah, it's okay. I mean, get rid of that.
Okay. So hello and welcome to all the viewers again. Today we are here with Dr. Nikhil in the day 2 of the MedUK webinar. So Dr. Nikhil is an internal medicine trainee at Southend University Hospital NHS Trust. So over to you, Dr. Nikhil.
Hi guys. Hi, my name is Nikhil. I'm one of the internal medicine trainee currently working in Mid and South Essex NHS Trust. The reason we are holding this webinar is mostly to talk about how one can wade their way through applying for internal medicine and actually starting their job and a position as a medical resident in the UK. We have previously talked about applying for the GMC license and how to go about it, which was PLAB pathway to be specific. I think it's imperative that we talk a little more in detail today because there's interest among people to know a little more specifically about the training pathways. We had the surgery webinar yesterday where the interview process, the portfolio process was discussed. What we could do is have a good look at internal medicine training, and hopefully, it should be a little more clear to you. And after that, of course, we'll have a Q&A session of some sort at the end. So let's begin with it. Agam, if you don't mind, if I can just share the screen.
Yeah, you can start sharing the screen.
Yeah, if you can let me have the permission, I think there's some setting you'll have to do.
Okay, just a second.
Yeah.
Okay. Okay. Now try sharing.
Yeah, I think so. Let me have a look if I can do it. Yeah, I think that works. All right. So I think this is a little more descriptive than I would think. I think we go through it step by step and have a look at what NHS recruitment really looks at. If we look at what the eligibility is exactly, what do you need as a prerequisite to apply for the medicine training? I think it's obvious you would need your MBBS certificate. It's difficult to apply for it, and during your med school years, ideally you should have completed your internship or an FY1 equivalent year in the country that you're applying from. Subsequently, once you're done with your internship and once you are done with your MBBS and you're graduated, you could apply for your PLA pathway and get your GMC license. So MBBS and GMC is quite important. Along with these two things, IELTS exams is also something that they look at. Um, IELTS also does form part of the prerequisite that they look at while you're applying for GMC. So if you have your GMC, it's obvious that you have your IELTS by now. Um, Other thing that you need to have when you apply for IMT. So from henceforth, when I refer to IMT, it's internal medicine training. They've recently changed the name from core medical training to internal medicine training due to a few changes they've done in the program. So if you're applying for IMT, there's something called as a competency. So what does competency mean exactly is that they look at you in a way that you're competent enough to actually apply for the IMT program, competent from your day-to-day work point of view. And if you're able to understand the basics of medicine and the workings of NHS, is when they would say, yeah, you're competent enough. Now there's many different ways in which you can get your competencies signed off. One is your CREST pathway, which is the certificate of readiness to enter specialty training, a form which is usually filled out if you worked in the UK in any capacity for about 3 months. Then your consultant needs to sign a form which goes through many different small fine prints of points and looks at various different angles in which you might be competent. Other way is you could apply for the foundation program and go through the 2 years of training, after which you'll be again competent. You could also apply for a standalone F2 year and gain your competency. That's come up in the last 2-3 years is the VAST program, which is the widening access to specialty training, where again you can get your competencies signed off. So I think these are a few bits of important prerequisites that you need to have before you apply. Along with these ones, there's also the ALS, the Advanced Life Support, and more specifically from the Research Council of UK. If you have done this, which is usually valid for about 4 years, you should be quite okay to apply for the program. Next bit that is the NHS experience. Now, although legally you can apply for the IMT program without having worked a lot in the UK before that, but it's quite. I would highly suggest that you work for a bit in a foundation level capacity or at a level of a junior clinical fellow, where you get to know a little more about the system than the science per se. It's quite important to know the various different pathways to which the patients can be referred to maximize their care. So NHS experience would something be very, very valuable in your journey to apply and get into medicine training. The last two bits there I have mentioned are the visa and RLMT. Um, Again, if you are an IMG applying from different countries, you might be subject to applying for the visa in that process. Most likely, you will have to apply for the Tier 2 visa, which is a working visa which allows you to come and work. Otherwise, if you've been here in this country for long, or for if your parents have been here and if you have the indefinite leave to remain, which is the ILR, then again you're good to go to work here in the UK. Next is the RLMT. Now, what RLMT is the Resident Labor Market Test. Now, this used to be the case up until a year ago, where usually, so for any training program, there's 2 rounds of applications. The first round is where only the UK citizens and the candidates with ILR can apply, and only then, when if there's any seats remaining, if there's any positions remaining by the end of it, then in the round 2 you could apply for it. So if you're RLMT exempt, you can apply for round 1. If you're RLMT, if it applies to you, then you can apply only for round 2. Now that used to be the case up until a year ago. Now what they've done is they've got rid of the RLMT. We don't really know if it's coming back or not, but it's not there anymore as of now, and everyone is eligible to apply in the round 1. So there's a lot of questions if you can apply for round 1 or round 2. At this point, everyone is eligible to apply for round 1. Doesn't matter what your nationality is or where you have graduated from. So that summarizes the very basic bits of what they look at, of what you might require and what you might prepare in view of applying in the future for the program. Now, let's have a look at what the rough timeline is of application to that program in a single year, in the single year of intake. Now the timeline that I've put is the latest one, which has come out like a week ago. Although do keep in mind that this timeline has taken into consideration the COVID pandemic. This may change in the future, or it may just stay this way. So we're not really sure how this is going to turn out the next year. Although for this time's application, this is the timeline that we'll be following. So if you have a look, the applications are usually done on a website called as Oriel. So you could apply there, and which usually opens up in the month of November. So I think this year's applications have opened on the 5th of November, and they'll close on the 1st December. After which you go through various different rounds. I would say the first one is a long listing, and then there's a short listing. After which it's basically they see if you have ticked all the boxes of the eligibility criteria that you need to fulfill. After which you'll be going for your interview process. Interviews happen usually around the end of January up until mid-February. That's roughly the time in which the interviews take place. And over a period of a few months or so, you'll be offered posts. You'll have the chance to accept or reject or wait for an upgrade, like any other training pathway. And eventually, once you have accepted, you go through all the paperwork, you get your visa done, and then you are good to go, and your post will most likely start in the month of August. So August is when everyone's training period starts. So that's roughly what the timeline would be. You apply in November, you go through the criterias of eligibility in about a month or so in December. You sit for your interviews in January, February period, and then you have your positions being offered to you in the subsequent months, and then you start working in August. I think that should give you some idea as to what time period you should look at, and what time is available for you. You can keep in mind that the applications are in December, so you need to have your portfolio ready sort of by then, and have some mindset and streamline your entire process. So this is the latest timeline we have at the moment. But again, like I mentioned earlier, We don't know if this is going to stay for the next year, but this year definitely. But again, it's COVID permitting how we go about it. Um, I think that should be it for the timeline question that there is usually. Um, Now you have to understand that when you apply for the internal medicine training pathway, there's two big things that are looked at. One is the interview, how well you do in the interview, and then there's a self-assessment. Self-assessment, what that would mean is how well you, how much or how many points you would give yourself for the portfolio that you have created. Now, the scoring system, how much you can score in which aspects, in which domains, we'll have a look at it in a minute. I think it's important to look at both the interview process and the self-assessment, which is your portfolio basically. The amount of score you'll get in each of them individually will be added up together, and that will give you a final score. And depending on the final score and the preference that you give in your application for which region you want to work in or what kind of rotations you want, you'll be offered a post. So two main things in my you have to keep in mind is the interview part and the self-assessment portfolio. Two things. So let's take it slow. Let's have a look at the interview first. If you do you have any questions so far, Agam?
Yeah, Nikhil. So I just had some questions.
Yeah, go
Uh,
on.
so in the eligibility criteria, you said regarding IELTS as prerequisite. So
Yeah,
like, can people give OET if they are not choosing to give IELTS?
absolutely. I think that's a good question. There's been recent changes with respect to the English exam. When I sat for my exams, I think only IELTS was acceptable, but recently they've been making quite a lot of changes in that. Uh, GMC does accept your OET scores for your once you've cleared your PLAB exams, and GMC needs to look at your English exam scores.
Yeah.
They do accept your OET. So if you have your OET scores, GMC does accept it, and if you have your GMC in your hand, any resultant or any further applications that you make shouldn't be a problem because you've already fulfilled the criteria for GMC.
Okay. Okay. Next question was regarding the competency you talked about, like the competency, crest and foundation, standalone things.
Yeah, yeah.
Just give me a more insight about the thing, because I don't think so people really understand what exactly competency is. Once you enter the like even the non-training job, what exactly the competency is to enter the training job.
So the competency, the crest. Let's have a look at the crest form first.
Yeah.
The crest form has 56 points in it.
Okay.
56 points where the consultant has to score you based on every single point. Now, what those points could be, it's a very generalized, um, quite 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 descriptive, I would say,
Yeah. Yeah.
in which you can be it can give you a sort of quality score in some sense, where they look at what your communication skills are. If you're able to communicate your decisions to your team, that is one of the points. Other would be, are you able to break bad news to the patient if the patient has had a very bad diagnosis, something that the patient wouldn't want to hear or something anyone wouldn't want to hear. If you're able to break that news in a good way with empathy, sympathy, and care, that would give you again 1 point ticked off. So these kind of things are looked at, and that's what competencies mean. Competencies also would mean, if you're able to do very simple procedures, like are you able to cannulate a patient? Are
Hmm.
you able to do an ABG? Are you able to do a peak expiratory flow rate meter? Are you able to give subcut injections? Are you able to give IM injections? They look at a very basic junior doctor level competency. Other thing would be if ethical standpoint, ethical dilemma where you're given a difficult situation to deal with, and if you're able to do that. Other thing would be there's clinical points to it as well, where is the junior doctor able to identify a deteriorating patient? So that would, if you have been able to, and if the consultant knows you enough, then that would give you another yes in it.
Okay.
If you are punctual enough, if you can conduct duty of candor. Duty of candor is where if you have committed any mistake, you should be telling the patient about it and telling what problem was there, what could be rectified, how it could be prevented in the future. If you have done something like this, and if you're able to do that, again, you're competent enough in that aspect. So there's 56 different points. I think although it sounds quite a lot that it's 56, but over a period, if you have worked with your consultant for about 3 months, and if that consultant knows you, you formed a good relationship with them, you should have come across these situations by then, in the span of 3 months or so. And I think any consultant would be happy to sign you off on those competencies. Does that make it a little more clear to you?
Yeah, it's like I got the whole inside of it because I never knew what exactly the competency, and I think our viewers might be facing this.
Yeah, absolutely. Yeah. It's these fine prints that are usually lost, and people are not really aware of these. So I think it's good that you will know about this. Sorry, go on.
So one more a small question, because we are over here in application scoring part.
Yeah.
So you talked about self-assessment. So I think like if for say me and you are competing for a same job, I think self-assessment, even I'll give the maximum amount of marks I will give myself. So like how does that work?
Oh, good. That's a good question. Actually, if you so the way you justify your scores is by showing physical evidence and proof.
Okay.
Showing that, oh, you have done this, and you could have a letter signed by your hospital, by a university, by anywhere, any organization that you have worked with so far. You could have some sort of a letter which says that, yeah, you have done this. And you could score yourself.
Okay.
And then in the interview, if the interviewer asks you to see that, and it's anyway checked, it's checked by them prior to you go to your interview to see if you have rightly scored yourself. But so there's been cases where people are inclined to give themselves a little more marks and points than what they deserve to have. But it's, if you don't have the proof for it, the points not counted. So it shouldn't be that difficult.
Yeah. Okay, cool. So that was it. I think we should continue.
Yeah. All right. So we've come to a major chunk of the webinar now, where we'll have a look at how the interview process is run, and then we'll have a look at the self-assessment portfolio as well at the end. So when you go for your interview, there's 3 main stations. What station is, you have to go now. This is before COVID. In COVID time, I think this year they are planning to keep an online interview where all 3 of these will be just conducted online and in one single sitting. This method that I'm going to explain to you has been going on historically since forever and might just come back in the future. But anyway, previously you physically had to go for your interviews. Now it's just online, but they look at the same things. They look at these three main stations. Earlier you had to go for a clinical station, then you had to go for a second station, which was the ethical part, and the third one, which was the application and the training station. So you physically had to go to 3 different rooms, talk to different interviewers, and every room had 2 interviewers, and you talk to them and they rate you and they give you points on it. So there's again 3 main stations. There's the clinical, there's ethical. Along with the ethical, there's also the suitability and commitment. And the third and the last station is the application and training. Now, again, these words sound very general, but again, we'll have a look at it in more detail. Now, the clinical station. The clinical station is where you will be given a scenario, you'll be given a situation, you'll be told, for example, you are in the A&E, like the accidents and emergency or the emergency department, or for example, you're in the ward, and there's some sort of emergency. There's some peri-arrest call, or there is emergency, adult emergency somewhere, or this is the patient that you are seeing. That situation will be described to you. You'll be given a few minutes to think about it and make your own sort of investigation plan, treatment plan, how you would escalate it, what point you would ask for help. You sort of make a mental map of what you're going to do once you go in. And it's sort of a role play where you talk to the interviewer in a way that they are the patient, and you ask them certain questions, and the other interviewer will ask you questions back, like, okay, what next, what would you do next? So again, so if you have a look at what there is on the slide, there is the potential treatments possible, is what next steps you would take for that patient, what kind of information you can gather, for example, the history taking, basically. This is a way in which they can judge you clinically. And this clinical scenario that they will have described to you earlier before the station is something that is not that's something that you see directly just before the interview, just before the station. Actually, this is not something which is published way before the interviews. So it's given to you right away there, and you have to you're given about 2 minutes and you make a mental treatment plan. And the most important thing is they also look at your communication skill. If you're able to communicate well with the patients, if the patient isn't doing that well and there's imminent death in the near future, if you're able to communicate that well with the patient's relatives or the patients, or if you're able to communicate well with your colleagues, if in case you need to hand this over to someone. So communication skills is important in the station. So clinical station is important. From my personal experience, my station was about a 65-year-old lady who'd come in with facial drooping, arm weakness, and slurring of speech. And I was given a background of diabetes and hypertension. That's all I was told. And I went in and I talked to the interviewers. Basically, it was, long story short, it was the lady had a stroke. So what potential treatments can we talk of here? So I suggested many different some treatments, like we could possibly do a CT scan of the head to see what kind of stroke it is, if it's ischemic or a hemorrhagic, and what different pathways. There's something called as a stroke bleep who needs to be contacted once there is a potential stroke patient in the emergency department, and what rehab could be offered to these patients. Now, this may sound a bit daunting, but if you have worked for a year in a junior clinical capacity in the NHS and the UK, this station shouldn't be that difficult, because you by that point you will have done many on calls in your work, and you will have come across these situations. And I would suggest to prepare for this clinical station. One good suggestion would be to have a look at the to use Oxford Handbook of Clinical Medicine. I think that book has helped me and many of my other colleagues quite a lot to prepare for the interviews, and particularly the clinical station. There's you will be awarded points and scores depending on what answer you give to that situation. If you're able to react well, if you've asked for help at the right time, and if you have suggested the good management plan, if you're able to again communicate well, if you've been able to interact well with your colleagues, your patients, because again at the end of the day, we are all working for the patients, isn't it? So this is something where they will look at you and judge you pretty well from a clinical point of view. Does that make sense, Agam?
Totally. Yeah, it makes sense. But I just one more. I have a question, small
Yeah, sorry,
question.
go on.
Like someone who has cleared PLAB recently and who has got a job in the NHS, and I think he's got for say a non-training job. He is going through the FY2 year,
Yeah.
and he goes for like 6 7 months, and then he tries to apply for the uh, this internal medicine training job. So will he be able to answer these clinical station questions easily, or does he has to do anything else, or he has to study other things, or he has to take some other classes or anything?
I don't think you need to go for any academy or any course to prepare for the clinical station, because the fact that you have your GMC license and your registration means you have passed your PLAB 1 and PLAB 2. PLAB 1 and PLAB 2 is where they will have covered most of these clinical stations anyway. More more specifically the PLAB 2 part, because
Hmm.
that's when you'll have your OSCE station, where you will have had such situation and such circumstances where you've had the question before and then you've interacted with the patient in a role play fashion. Um, and if you have the GMC, again, you have the basic knowledge. But again, if you have worked as an F2 or any foundation or any junior doctor level at the time of your application for about at least 6 or 7 months, I think by that time you will have seen these patients, and they don't really expect you to answer very specialty or specialized medicine or specialized cases where the answer could be very ambiguous or very difficult to give. These are very basic, everyday on-call patients that you see in your day-to-day practice.
I think
So
the house job and the internship we do back in our home countries, I think those will also help in this.
absolutely, yeah, yeah. Clinically, absolutely, they do help you because the science remains the same everywhere, in my opinion.
Hmm.
Uh, in my internship, I have seen stroke patients. I've seen stroke patients in my junior doctor year. So I was able to use both my experience together and answer that question there in that station. Um, what helped me specifically from my NHS experience, other patient pathways. Patient pathways, basically what it means is the different pathways in which the patient can be referred for further care. Now you're just on call, right? You have treated the patient, you stabilized, you've done the initial treatment, but the patient is later shifted to some other ward. What what then? What happens to that patient then? So you need to have some sort of a map in your head in which the patient can go through and get the maximum care and the maximum patient safety is ensured to him.
Okay. Makes
Yeah.
sense.
Yeah, so I wouldn't really think that you need a academy or any sort of coaching or classes for it. If you worked, I think you should be fine.
Okay.
Yeah.
Yeah.
Okay. So so interviews first station will be the clinical station. The next one is the ethical part. Now, bear in mind the second station has again the second station has two different parts to it. So we're looking at the first part of the second station, which is the ethical part, where you will be given, again, it's a role play OSCE type situation where you're given a, a, a circumstance where you have to deal with the ethical dilemma, and how you would deal with this is very important, and they would judge you on it and give you scores on it. Now, to make it easier for you to understand what that could mean is what potential cases would be. The case that I got in the ethical station in my internal medicine training interview was, I am a junior doctor and I disagree about the medical plan with my registrar, and I don't really think what he has suggested is good for the patient. And there's a better way in which the patient could be treated, and there's a better way in which the patient could be referred, so that not a lot of harm comes to the patient and the patient is safe in many ways. So how I was asked, how would you deal with this situation? So now you have to bear in mind that at the end of the day, we are all working for the patients, yes? So the patient safety is of the utmost importance. If you have a disagreement with your registrar, again, it doesn't mean you have to go and fight with him, but because he's your teammate, you need to have team skills, you need to have communication skills. So you need to sit and talk to that registrar of yours and come to a midpoint, or suggest to him what can possibly be done, and not let it devolve into some sort of a conflict, and have a nice conversation, and eventually you reach a point where everyone is happy with the decision. Following this, I was asked if the registrar still disagrees with my plan. So what I would do, will I still listen to what my registrar says, or I would escalate it and talk to my consultant? So again, the right thing to do would be to talk to the consultant and sort of run it past him to see if we are doing the right thing. And consultant would be the best person to give us a direction. Um, so these sort of ethical scenarios. Other would be breaking bad news. You told you have this patient with a massive uh, subarachnoid hemorrhage, or a aortic aneurysm is leaking, or there's a perforation somewhere. You need to tell the patient's relatives that the patient might not survive and might not make through the initial treatment or any subsequent ITU admission that the patient might need. So the way in which you would break the bad news is important. Uh, it's more about again the communication skills. um, it's a completely hypothetical scenario. So there's ways in which you could prepare for this. The junior doctors here who have graduated from the UK, who go through the whole foundation program of F1 and F2, they have to sit for the SJT exam, the situational judgment test, where they have had some practice about these hypothetical scenarios, about ethical dilemmas. If you have come through the PLAB pathway, you will have some stations, some PLAB OSCEs, and about ethical stations. So you shouldn't be far off, and this shouldn't be something very new to you if you're applying. Again, PLAB will be overruled in a few years, and there's a whole new system coming up, the UK MLA. But it'll still have the same syllabus for you. So I don't think ethical station again should be very difficult. If you have sat for your PLAB exams, or if you have sat for your SJT exams, you can be. And if you had some experience in again in the NHS in the UK, this shouldn't again be very difficult. Although there is the Oxford Handbook of Situational Judgment Test, which you could refer to and have some more idea and clarity into the station. How does that sound, Agam?
I mean, it sounds perfect. There's no question I can ask over here. But
Yeah.
again, uh, I think most of it is done while you're giving lab, so you don't need to worry if you've like studied properly uh, through your way to lab. So I don't think so. You need to worry about these stations much. And if you have
Yeah.
done your job properly, I guess.
Yeah. I wouldn't really worry about it. Although I would like to point out that PLAB or UKMLA in the future wouldn't be covering all the most of the possible stations that you could be asked. But yeah, I think you're right. It is a good start to start and understand what the ethical station what they expect from you,
Hmm.
and you sort of can expand a little on it. Other good the commonly asked ethical scenario is you're a junior doctor and you've gone for your ward rounds in the morning and your consultant has turned up drunk to the ward round. So what would you do? Would you go and confront the consultant, or would you just not say anything, or would you gossip about the consultant to your colleagues? Or I mean, there's many different ways in which you could react to it. Or for there's another one which I had come across in my PLAB exams was you go for a party with your junior doctor friends, and then you see one of your registrars snorting cocaine in the club, and he's come to the ward rounds the next day completely hungover. So what would you do in this situation? Again, I think it's very important that you keep in mind that patient safety is paramount. So you could prepare your answers circling that. So I wouldn't really think that should be very difficult. So I think you get what they're expecting from you, isn't it?
Yeah, totally. Yeah, I
Yeah,
guess.
yeah,
This
yeah.
this
That's good.
part is covered properly. Yeah.
Yeah. Okay. So this is the ethical station. So the second part of the second station is the suitability and commitment. Uh, what that would mean is, we talked about the self-assessment portfolio. Wherever you've scored yourself, the interviewer can ask you questions based on that, to ask you what have you done, how did you do it, what your experience was, what would you do in the future, what help did you sought for this. um, these sort of questions were something that were asked to many of my colleagues. You can also be asked about your interests outside medicine. Now, this is a very good point, because they also look at you not just as a medical trainee, but they also look at you from different angle as well. If you have something to contribute um, to the field of medicine, from your different interests that you have. That could mean if you've been good at sports and you've won some championship leagues, you could showcase that there. You could demonstrate if you have had a chance to build any apps, for example. You could show that, because these things do come in use in the future. You could integrate these things together. So the interviews really look at these things to see if you have any interest outside medicine. So that would mean this is what basically that they look at. And the last part would be the application. And this is the last station of the three stations of interview. Is the application and training. Again, it's they do look at your portfolio in this station as well, to see what sort of career you've had so far. If your career progression commensurates with your seniority. What that means is, if you have done the right things at the right time and matches with your level of seniority. If you are a MBBS graduate, or if you have already done MD in your home country, does your knowledge and the things and your achievements that you've done so far matches with your level of progression? Again, that you could add all the courses you've gone for, all the poster presentations, all the audits, all the quality improvement project, all the teaching you've done, all the leadership management roles that you've held so far. They'll be asking you questions on this, and you should be in a position to justify all the points that you've scored yourself in, and be able to elaborate on the experience you've had so far. So if you've done something, I would really suggest you add it in your portfolio and for your application, because then that gives you an edge over the other candidates and other applicants. So I think that part does cover the interview process. So basically, there's three different stations, and they'll judge you from many different aspects: the clinical part, the ethical part, the communications, and your portfolio and your achievement so far. After
One
this,
small question.
this one, I think.
Sorry, I'm interrupting you.
Sorry.
Yeah, so I have just one small question. How
Yeah.
is the third application and training part different to the B part of the second point? I mean, the commitment. Well,
Yeah, so there's a sort of a gray area there. They're at a liberty to ask you question in any of the either station that they would like. Suitability, and so if you have a look at it, suitability and commitment would mean what potentially you could do in the future, and what sort of plan you have for the future, where you see yourself in the next 5 years,
yeah.
is something that they look at. Suitability would be, would you be able to tell us about a few weakness of yours?
Hmm.
Why do you think we should accept you into this program?
Yeah.
What are your strengths? Tell us about a good example of a situation where you've had good communication skills. Tell us about your experience with teaching. Tell us about your experience with certain quality improvement project that you did. And the other one is the application and training, is again sort of the same, where they'll ask you, so okay, for example, if you've had a chance to present your case, a case report, for example, at an international conference, so they'll ask you questions. So okay, how was your experience, and what did you learn from it, and how did you come by the case report, and have you been keeping up with your training, have you been doing any online modules, have you been going to any courses, how's your learning been? Have you managed to sit for any exams? Have you signed up for any other degrees, any other postgraduate or undergraduate degrees that you could sort of do? They could interchangeably ask you these questions in these two stations.
Okay. Yeah. Okay.
Yeah.
This makes sense. Yeah.
Yeah, so I think that should be a little that should make it a little more clear to you as to what they're looking from you, and this format will stay the same this year with COVID as well, because they're looking again. They'll be judging you on the same points, although the medium through which they'll be doing it is a little different. It'll be on online completely. If things go back to normal, very likely the physical form of interview will come back again. But again, doesn't matter if it's online or physical. The format remains the same. Yeah. So I think we can move on to our next bit, which is the portfolio part, which is the self-scoring portfolio bit. Like I mentioned earlier, for your final score, for you to get into medicine training, to become medical resident, you need to have had a good interview and good score in your self-assessment. Now, in your self-assessment and scoring, there's many different things I look at. And the number that you can see on the slide there is the maximum number of points you could score in that aspect. Now, there's additional undergraduate degrees or any postgraduate degrees you've done, any other achievements, presentations, publications, teaching, training in teaching, quality improvement projects, audits, and leadership management. Now we're going to have a look at this individually, so that you have a little more idea what exactly these things mean. But if you just have a look at what it is, it roughly comes up to about 58 points. But these are the maximum points you could score in each of them, and your goal would be to it's sort of a tick box exercise where you have to make sure you've done everything and you've tried to score the maximum points as much as possible in each of them, because that again puts you at an advantageous position as compared to the other candidates, and would eventually give you a better position or a better job or the preferred job that you have. So let's take it slow. Let's take it one by one. Let's take it. Let's have a look at the first bit, which is the additional undergraduate degree. Now, like I mentioned earlier, the maximum you could score is 6, and it goes on decreasing as you have lesser and lesser achievement in that aspect. Mm, Now, additional undergraduate degree could be, for example, many countries have a concept of a pre-med. I've had some of my colleagues in India who have done a BSc before they went into MBBS. They did 3 years of BSc and they did masters after that, and then eventually went to do apply for MBBS. So again, if you have done these with first class honors, that would give you the maximum point, which is a 6 points in this. If you haven't, or if you have done other medical course or other medical degree, you'll get lesser points in this one. And if you haven't done any, you won't be scoring any points in this. UK graduates usually have a concept of intercalation. What that is, if for example, if their MBBS is for 5 years, intercalated MBBS would mean their MBBS will be for 6 years, but between the second and the third year, or the third and the fourth year, there'll be a separate year where they'll be studying something related to MBBS, but not exactly MBBS. So that could mean strictly a BSc in bioinformatics, or that could, or some allied course that would help them understand medicine a little more. Some universities do offer it, some don't. So if you have any other degrees that you have done before or during MBBS, I think you should be good to score some points here. The next bit would be the additional postgraduate degree. Now, there are ways to score some points in the postgraduate degree. Bit here is you get again the maximum points if you have a PhD. If after your MBBS you have managed to do a PhD, you get the maximum points here, which is a 6 points. And then again, it goes on in a decreasing fashion. If you've done MD or MPhil, gives you 5 points. If you've done MSc or MA, it gives you 4 points. If you've done MD with just a dissertation, that gives you only 3 points. I think most of my colleagues in India who have done MD after their MBBS have done a dissertation. They haven't done a 2-year original research. They've done a dissertation. So I think they would fit in that category of scoring 3 points here. And if you have done any other postgraduate or a diploma course, you'll be scoring 2 points in this. And if you haven't, again, you'll not be scoring any points in this one. So I think there's an element of pre-planning of scoring these points. If you have the interest, you would be going to do your PhD, or you could do MD and then apply, or you could do some course you have interest in. and sort of try and gain some points here. Although realistically, let me tell you, it's quite difficult to score points in this one and the undergraduate one, because not everyone has the opportunity to have a MBBS which has an intercalated BSc in it or a BA. Um, a minority of my colleagues or a minority of the acquaintances I have from back home in India have done BSc before their MBBS. Most of them have straight gone into MBBS after their junior college years. So they haven't had the chance to do this. So you can sort of imagine that most of them, not just most, but all of them who have scored maximum points in undergraduate degree and postgraduate degree have to be a little senior than you. They cannot be fresh MBBS graduates. They will have done a little more. So they'll be a little senior to you in age. So if you're competing with these people, you'll be the younger lot of the cohort there. Um, so you could pre-plan this and think if you have any interest in anything, and definitely by all means, please go and pursue it.
Yeah.
Yeah. So the next bit, the additional achievement. I mentioned earlier the maximum points you could score in this is 6. So if you have achieved distinctions or honors, if you've passed your MBBS with honors, if you were in the top 10%, 15% of your class during your MBBS, that would give you more points. Again, that would give you 6 whole points. If you manage to bag any awards at a national level, that would again award you give about 4 points. And any other merits, any other prizes you've won, any other distinctions, any other awards you have uh, during your undergraduate or your postgraduate as well, you'll be given 2 points for that. And if not, again, you unfortunately will not be getting any points in this bit. So moving on to the next one, presentation and poster. The maximum points you can score in this one is 8. And depending on the level at which you have presented your poster or given the oral presentation would determine the points. Now, it also matters if you're the first author or the second author or you're the co-author. If you've done this regionally, locally, nationally, or internationally. So the best way to get the maximum points in this would be it's an oral presentation where you were the first or the second author, and it was done at a national or an international, international medical meeting. That's how you would score the maximum points here. Again, you can do this at a local or a regional level. Could be just a poster presentation, but again, that wouldn't really fetch you as many points as the top bit would. But definitely, I think with COVID, what's worked in this in our favor for this is that most of the conferences, most of the meetings, annual meetings have become online. So even if it is international, you don't really have to physically go there. You don't have to physically go for a conference and present something. You can just do it online now. So I think it's made it a little more easier for you. And for future candidates to do this, I would suggest the applying in many different countries for these meetings and try and present something. And if you have and if you do manage to get some awards in it, I think you should be good to go. So let's have a look at the next one, which is the publication part. Now, this is a bit too much to take in at first, but the best way to get the maximum points, which is 8 in this, would be to have 2 or more PubMed cited publication. What PubMed cited is, I don't know, Agam, if you're aware of what PubMed is. It's basically an indexing website where many different publications are indexed.
Yeah,
Uh,
yeah.
so if it is cited in PubMed, it makes it a little more legitimate in some sense, I would say. And if you have 2 or more of these, and you are the first author,
Hmm.
or the first joint author, that would give you the maximum point, which is 8. Again, it goes, the amount of points you can achieve go on reducing depending on how many you have done. What author were you? Were you first, second, or you were a co-author, or is this just a chapter of book you've written? Uh, if it is peer reviewed, non-peer reviewed, there's many different aspects which are taken into consideration. So I would really suggest, if you want to gain the maximum points in this bit, I would suggest start looking at research options right now, as early as possible, to be honest. Something that could be potentially published, which is peer reviewed. Peer reviewed is basically, it goes through sort of a check where senior editors have a look at it and see if the paper that has been written is legitimate or not and can be published or not. That makes it a little more peer reviewed. And if it is PubMed cited, then you should be good to have this. So the next part looking at is the teaching. The sort of way that NHS is the path that they have chosen in the last decade or so, and many other medical systems are trying to do that as well, is they're trying to develop this sense of teaching among the medical residents and trying to sort of nurture a new generation of doctors who are not just practicing medicine but teaching as well, so that they could further on for later teach their juniors, so that the cycle keeps on going. Teaching is given a lot of importance here in the NHS and in the UK and for your applications. So the maximum points you could score in this is 6. Now you have to really look at what does teaching mean exactly. The way for medicine training, maximum points you can achieve for teaching would be to design and organize a teaching program which would improve the locally organized teaching for healthcare professionals or medical students. And you should have done this for approximately 3 months or longer. And if you look at the last bit, you should have the evidence of formal feedback, because if you have the feedback, then you sort of have a opportunity to reflect on what you did well and what didn't go well, how you could improve. You also get a little more insight into the target audience, the target population that you have, to see what they want from you, if it's the right audience that you're looking at here. Again, this goes on decreasing over a period as you do lesser and lesser. You can see you'll score only 5 points if you have done only one session, but over a period of 3 months or longer. Um, Again, they look for, if you have a look at each of the points there, every single one asks for an evidence of formal feedback. Any teaching you have delivered, they want they do want to have a look at the formal feedback that you have received. If you have occasionally taught medical students here and there and have the feedback, that would fetch you just 2 points. And if you have done no teaching at all, that would fetch you no points at all. The way I scored points in this is I was a tutor in physiology in my medical school for approximately 18 months, where I came up with a small teaching program separately to teach the first medical students about medical ethics, and set up a 4 different lecture series and went through many different interesting cases of ethical dilemmas. I started this for the first time medical students to inculcate this sense of ethics in them before they get very engrossed with the clinical part of MBBS, so that they have a little more time to reflect on this. And because I was also teaching not just MBBS students, I was teaching dental students, physiotherapists, exercise physiologists, and nursing students as well. So I've had a chance to teach cross-platform in different specialties. That and because I collected evidence during my teaching, I had a chance to score quite good well points on this one. So if we can move on, Agam, I'll let you ask a question.
Yeah, I just have a small
Okay.
question, Nikhil. I mean, while teaching, like I get the point when we're holding a webinar or while we are doing something that counts and we'll take the feedback of the students or the
Yeah.
people who are attending it. But you just told me that you were the tutor back in your med school. So like you developed a whole new program. So how did you collect the feedback for that? You just circulated the thing amongst the students, or is that
Yeah.
enough?
Yeah. So what I did was at the end of my one of my the flagship ethics program that I initiated and talked through them. I set up like a very formal program. It was there before, but it wasn't very formalized. I collected many different interesting cases and I talked to them about this. At the end of the 4 lecture series, I circulated a feedback form, like a physical feedback form. I gave it to each and every student, and I asked them to fill it out so that I can reflect on it and have a little more insight as to if I'm going the right way or the wrong way. So I could make those fine tuning for the next time that I deliver that teaching. Does that answer your question?
Yeah, yeah, it makes sense totally.
Okay. So that's the teaching bit. That's where you can score points in teaching, right? Now, that's training and teaching. If you're teaching, you can go for some training that helps you in teaching. So if you've had a master's level teaching qualification, then that gives you full points. That is 4. If you have had a chance to do a diploma or a PG certificate basically in teaching, for example, medical education PG cert, that would give you 3 points. If you have had some other form of training, that would give you points, but not as much as the master's or the PG certificate or the diploma would offer you. Um, and the least amount of points are awarded if you have done the training in teaching for no more than 2 days. So, if you have not had any training in teaching at all, that wouldn't really fetch you any points. So there's many different programs, many different courses you could apply for and sort of try and get more points in this aspect. Um, Moving on, the next bit is the quality improvement and audit. Um, audit audit is something that's not well understood among the IMG population. You need to understand what an audit is, first of all. It's basically checking if the way medicine is being practiced now, is it up to the mark? That's the most simplest way I can put it in. If it is being done in the right way, and if there's an improvement that can be done, and once you have implemented that improvement, you can check the compliance to any of the standards or the rules and see if there's been an improvement. And if there is an improvement, that would mean that is a quality improvement project. Although there's a huge gray area between what a quality improvement project is and what an audit is, although there's many similarities between them. Um, with that overlap, it can be a little bit confusing, to be honest. NHS in the last few years has been slowly moving from the audit part and has been going more towards quality improvement project, but they remain more or less the same. So the way you can get the maximum points is if you have improvement in all stages of 3 or more cycles of a quality improvement project. Now, what cycle is you will have to go through what an audit is, where audits are done in cycle basis. You do it in cycles, and if there is an improvement, then you will be scoring the maximum amount of points here. And if you brought about change in the medical practice in the hospital or in the institution or the organization you're working in, yeah, this one shouldn't be that difficult. Although it's a bit difficult to organize a quality improvement project or an audit, um, because you need to look at what the standards are, you need to check what the compliance is, you need to check what the current practice is. But I think this is something very reasonable and something very achievable, if you ask me. Uh, so if you have been involved in the audit and if you have been able to demonstrate improvement with the physical evidence by from your institution saying, yeah, Dr. So and so has done the audit or the quality improvement project and has shown substantial improvement. Again, there's your evidence, there's your proof. You can get the points there. And I think this is the last bit of leadership and management. If you have or had held a national or a regional leadership or managerial role for 6 or more months and can demonstrate a positive impact, that will give you the maximum points, which is 6 points. That could mean many different things. If you are a BMA rep, BMA rep is a British Medical Association, the representative for a region. If you've held that position in a state like Essex or Wessex or Midlands or Yorkshire, if you manage to hold a position like that, you'll be scoring quite good amount of points there. Again, you have to demonstrate that you did bring about some sort of change, some positive impact, positive change during your tenure there. And that doesn't really have to be limited just to a PMA representative. You could have done this in other countries as well, in many different aspects or fashion and capacity. I think you should be able to score points in this one as well. So what do we get from this? What have we learned? Is that you really need to look at what the prerequisites are, like basically the eligibilities. If you're eligible enough to even apply for IMT, which is internal medicine training. Second is your interview. You absolutely need to nail the interview. You need to be able to be good at giving answers and being able to put in a position where you'll be given a difficult scenario and you're able to wade through it. And the third one is the portfolio. So portfolio is something you should be starting as soon as possible and sort of build towards it. You can prepare for your interviews in the near the interview time. prerequisites is something that you continually work on anyway if you're trying to apply for PLAB pathway. Um, if you're able to ace all three aspects, I don't think it is difficult to get a position in internal medicine in the UK in NHS. One very important thing I would really suggest you do is that you start as early as possible, because you don't really want to end up with just 2 months in your hand, not really having done many things, and you being desperate to score points, and there's not been enough events around, so it might be just difficult to score points in that aspect. Um,
So yeah, I got the most of it, but again, I have one small question.
yeah, so go on.
So I asked this question to Dr. Dimitris also yesterday when we were
Yeah.
talking about surgical training. So he had, I think, the similar kind of outlook of the thing, but he also talked about electives. And I'll again ask you the same questions about the electives. What do you think? How should IMG like build his electives or go through? What is the part two electives? And if someone wants a view of it or the path of it, how should he go through these things?
Yeah, the Agam, I like your question. If you have a look at the current slide I have, I think the last point I mentioned is about the electives and the observership. Let's talk about it now. Um, Electives and observerships, in my opinion, can be quite helpful in your career, because not only does it help you make a decision if you want to come and work in the UK, but it also helps you gain a little more insight into the system. There's many different ways in which you could apply for an elective or an observership. Um, you could directly contact the hospital. You could contact the consultant there and ask them if it's okay for you to come and observe them for about 4 weeks time, for example, in the field of your liking. For example, you could say, okay, I want to observe acute medicine for 4 months, or I want to observe emergency department for 4 weeks, sorry, or just cardiology or general surgery or pediatrics or obs and gynae. You can arrange for those by directly contacting the hospital or the consultant, or if you know someone in that hospital, they can sort of help you in arranging that. Um, but if you ask me, I think by all means go ahead and do an observership. That will clear a lot of questions in your mind. And also the added benefit to the observership is if you are able to do an observership before your PLAB 2, I think that will be a good thing to do, to be honest, because you'll be able to get to know the language, the diction, the choice of words, the communication skills you would be it would be required from you for the PLAB 2 exams from you. So that sort of prepares you for the eventual exam, and also it would be a good addition to your CV as well, because when you apply for your first job in the UK, which is a non-training or a training job, whatever that is, um, they would obviously prefer a person who's done an observership, because he'll have a little more idea and more insight than someone who hasn't had that experience. I think so. Yeah. So if you want to arrange for electives and observerships, go ahead. You can look at the I think King's College. Then there is Charing Cross, Imperial are the ones which have an online platform in which you can apply for the observerships. But uh, now, as Medicapolis, what we are planning to do is that we, are, we will be helping IMG medical medical students and junior doctors to sort of arrange for their observerships, where we can try and get some arranged in our own in the hospital that we are working in currently. Although it might be a bit challenging at the moment with COVID, because air travel is not possible. There's lockdown everywhere. But this is something we are working towards in the future, near future, once everything is a little more relaxed. So definitely do get in touch with us. We might just be able to arrange for something for you in the field that you would like, and shouldn't be that difficult. So yeah, I think we can have a look at it.
That's great. Amazing, Nikhil.
Yeah.
Thank you so
So
much.
yeah, that's okay. Just to wrap it up, just a few points that's still
Yeah.
left is that I would highly suggest you have some NHS experience as a junior doctor before you apply for IMT. There's also some interview skills courses that are run by some organizations, which you can go for and sort of improve on your interview skills. Um, People usually also have a question about what would you do after IMT? IMT is for 3 years. What would you do after that? After that, you would naturally apply for a registrar level job, training job, and train for 3 or 4 or 5 years, depending on the super specialty you're applying for. And after that, you'll become a consultant. Um, there's also a question about MRCP. Should you sit for your MRCP now or later? I think it's a very personal choice. You can start preparing for MRCP now and start clearing the exam now. But trust me, there's no hurry for that. You can start your MRCP exam even when you are in your IMT program. You don't need to necessarily give it before you even apply. You can do it once you're accepted into the position. So yeah, I don't think it should be that difficult. So I think that wraps up all the major points that you really need to look at while applying for IMT. So if you're able to go through it, it shouldn't be that difficult.
I
Okay.
like that poster, that meme.
Yeah. What, do you have any questions, Agam? Go on.
The questions are, I don't really have any questions, but one small thing. Any message you want to give to our viewers who are watching us right now and who will watch us in the future? Who are who will be applying in future for UK and for training jobs in internal medicine?
Yeah. You know what? Yes, I think I want to give a message is that I think there's some sort of misconception amongst many IMGs. There's a misconception that, oh, you can't really get into residency in the UK or in the NHS. They think, oh, you can't really get into medicine training or surgical training or any training that you like. I think every training is possible. I don't really think there's any sort of discrimination. If you have your portfolio well, if you have good interview skills, if you have good experience, I think it's doable. It's completely achievable. I think you just have to stick to your guns. If you're indecisive in what you want to do, that might just hamper you. And trust me, I've had colleagues, I've had friends who are a little more indecisive than usual, and eventually they weren't able to decide what they want to do, where they want to go, which exams they want to sit, and they're stuck in a sort of a limbo where they're not able to make a decision even now, and things become good or bad, you wouldn't know. I think if you stick to your guns, everything is possible, trust me.
Okay, that's great. Thank you so much, Nikhil, for
Thanks,
those.
Agam.
Over to you, Janvi.
Um, Thank you so much, Dr. Nikhil and Medicapolis, for taking us through the insights of internal medicine specialty training in the UK NHS, sharing your invaluable time and imparting knowledge to us. We, the Student Council of DYPSOM School of Medicine, are grateful to you for collaborating on the event MedUK with us. all the best for your future endeavors. And thank you so much for watching, everyone. Looking forward to hosting all of you for many such events in the future. Please like, share, and subscribe to our channel. Thank you so much.
Thanks, Janvi. Thank you.
Nikhil, I just want to do one small thing. There's a more option, like bottom right, I guess.
Let me check. Yeah. So if I can just add something, is we'll be posting a link for a feedback form so that we can have a little more.
In the comment section, we'll be posting a link for the feedback form. We'll be pinning the comment from the Student Council's account. So to all the viewers, we just want you all to go through that feedback form. And if you have any suggestions, or please tell us. Please let us know.
Yeah, I think that will help not just the Student Council of DYPSOM, but it also help Medicapolis to really help and understand what the medical students out there is looking for, isn't it, Agam? So we could sort of tailor our future programs accordingly and see how we could cater to them.
Yeah. Right.
All right. Thanks, Agam. Thanks for having me here. Thank you, Janvi.
Janvi, will you end the live stream, or should I ask Dr. Nikhil to go?
I'll end it. It's okay. I'll end it.
Thank you so much, Dr. Nikhil.
Thank you.
Hope to see you soon, and hope to collaborate more on such events. Yeah.
Okay then. All the best, guys.
Thank you.
Thank you. Bye.
Bye.